This is Chapter 10, Health Problems of Infants. So, vitamin imbalances, the biggest problem we have is with vitamin D. In fact, the American Academy of Pediatrics really recommends vitamin D supplements for many infants. Babies that are exclusively breastfed for more than 6 months, so nothing else is being added other than breast milk, should receive vitamin D supplements. Or babies who are breastfed but the mother has a low intake of vitamin D, they should be breastfed. Or infants who have minimal sun exposure. And then the other vitamin imbalance that we worry about is folic acid. All women of childbearing age should be on a daily supplement of folic acid because we know that a mom who's deficient in folic acid has a much higher risk of neurotube defects, and that is developing in the first weeks of pregnancy before many women even know they're pregnant. So the recommendation is that women who are of childbearing age, it's better to take that folic acid every day. So some nursing care management that we want on infants is to really encourage breastfeeding for 6 months, and a year is even better, but we'd like to see infants breastfed for a minimum of 6 months. And then the first solids they should get are rice cereal, and that's introduced between 4 and 6 months of age. The reason for rice cereal is it's fortified with iron. And those iron fortified cereals, like rice cereal, there's a few other grains as well, they should be given to infants up to 18 months because infants need that iron. Around 4 months, the maternal iron stores that they deposited during in utero are used up, so they need that extra iron. Malnutrition. There's 2 different types, the kwashiorkor and marasmus. Kwashiorkor is what you've probably seen on pictures of children in third world countries where they look, just thin, but have these big distended bellies. So those are children they're getting calories, but they don't have enough protein. And that distended belly is edema. It's ascites because they don't have enough protein. They don't have that oncotic pull from proteins in the blood, and they end up with that edema. Marasmus, this is just lack of calories as well as protein. Total deprivation. And often it goes not just with nutritional deprivation, but physical and emotional. And these kids, they look emaciated, but they don't have the big belly. Food sensitivity versus an intolerance. Well, a sensitivity is an allergy, and you've probably heard the term hypersensitivity for a severe allergy. This means the immune system's involved. You have an IgE-mediated response. The immune system triggers something to happen. And an example of that is cow's milk can have a true allergy to it. Food intolerances mean the immune system's not involved. You don't have that IgE response. Usually it's from a lack of enzyme to break down a particular substance. And again, we have the same issue with cow's milk, but it's that you don't make lactase, which is the enzyme needed to break down lactose. So you develop lactose intolerance. You don't break down the lactose, and so it kind of sits and ferments in the gut. And those are the problems that you see. So when we do see food sensitivity, so this is allergy, it can have different ways of presenting. Sometimes it's systemic, your anaphylactic shock, or growth failure. It can be GI symptoms, abdominal pain, vomiting, cramping, diarrhea. It can cause respiratory problems, coughing, wheezing, that runny nose, rhinitis, or the most common is things on the skin, rash, atopic dermatitis, which is eczema. So I love nursing alert boxes, and we have one that says IM Epi is given for a child with life-threatening anaphylactic reaction or who experiences severe symptoms such as itching in the throat, a barky cough, difficulty swallowing with dyspnea, so they can't swallow and they're having trouble breathing, wheezing or stridor, itching, flushing, urticaria, which is rash, angioedema, so those vessels are swelling, syncope, right, dizziness, bradycardia, dysrhythmias, hypotension. These are all sound bad. They are. Or anxiety, confusion, or a sense of impending doom. Don't downplay that. People who say, I feel like I'm going to die, that should be taken seriously, that sense of impending doom. So things that are not an allergy but an intolerance, such as lactose intolerance. How do we treat that? We're going to eliminate lactose or milk from the diet. Often they try and do that for a year and then reintroduce it in small quantities, and sometimes you can start developing the lactase. If we do have to use formulas without milk for that year to give that child that chance, we have some where the proteins are broken down into amino acids so they don't have to break them down. Progestin and Nutramigen are two examples of that. These are expensive, however. They say that if a child's allergic or has an intolerance to cow's milk, soy is probably not a good option, but I know some pediatricians will try that just because it's so much cheaper than going with the small protein formulas. Failure to thrive. This is what we call the child who doesn't grow well. They start out doing fine on that growth chart and then they start dropping down. So they may have been born at the 50th percentile and then they're down to the 25th. Now they're down to the 15th. We're going to intervene and see what's causing it. Is it an inadequate caloric intake? Is there something going on where for whatever reason they're not getting the calories they need? Or is there a problem with absorbing? They're getting the calories, but the calories just go in and out through the gut. They don't get absorbed. Or is there something going on where they're expending an excessive amount of calories, so their need is actually much higher than average? And we need to figure that out to figure out how to treat it. Diaper dermatitis, right? This is diaper rash. So how are we going to take care of diaper rash? Well, the first thing is to keep that skin dry. Change diapers quickly. It's really a mixture of stool and urine that cause the problem. It's not just urine by itself, but if we keep the skin dry, we're going to have less problems. Expose it to air. That's going to help keep it dry. Using a barrier cream, and when you do a diaper change, you don't need to scrub off the barrier cream. In fact, you can just keep putting layers and layers on top. When you do need to get it off, it's better to use something to remove it than to scrub hard, because we really do want to treat that skin delicately. Not overwashing, and especially not using harsh soaps to wash. The one recommendation is to use moisturizer or a non-soap cleanser for cleaning the diaper area, and avoiding things that have perfumes and alcohols in it. And many of the diaper wipes have those. So just a clean cloth with warm water may be the best choice for a kid who really has trouble with developing diaper rash. Atopic dermatitis. This is the name, the technical name for eczema. There is a real correlation between eczema and allergies and asthma. So just realize that when you see eczema, you should think allergies and asthma along with it. But how do we treat this? We've got to hydrate the skin, get moisture in the skin. It itches, and kids scratch when it itches, right? So relieving the pruritus, preventing flare-ups, and then that when it does itch, they scratch and they get germs in there and you get secondary infections. So trying to prevent those. On infants, that might mean keeping gloves on their hands. On older kids, it's going to be relieving that pruritus. And a hypoallergenic diet on some kids will help. Colic. Colic, also called paroxysmal abdominal pain. So paroxysmal, it comes and it goes, and when it's not there, it's not a problem, but then it comes. Colic, not every child has it, but when they do, it's abdominal pain. These babies often are very gassy, so relieving gas with the Mylicon drops can help, but they act like they're having stomach cramps. They kind of pull their knees up. They say it comes with the 3 C's, so they cry for at least 3 hours, at least 3 times a week for more than 3 weeks. And the other phrase you can think about, it usually starts around 3 weeks and they outgrow it around 3 months. And it probably just has to do with immature digestion, immature GI system. But they draw up their legs and act like their abdomen really hurts. It usually happens in the late afternoon or the evening, and it's usually the same time of the day for kids who get it. And because it's abdominal pain, you want to hold the kid. She really has them just sort of sideways, but face down, so your hands are on their belly, sort of massaging the belly, warmth on the belly. Vibration they tend to like. So this is a kid that they take on a car ride because it's the only thing that calms them down. But holding them face down, holding them across the belly is helpful. SID, sudden infant death syndrome. We started the Back to Sleep campaign and saw a huge decline in the incidence of SIDS. So we know that that is better. Babies should sleep supine, sleep on their back. Other things that make it a little more, the risk higher is co-sleeping, especially on couches, and then sleeping prone, sleeping on their stomachs, sleeping with pillows, overheating, so they have too many blankets, and then soft mattresses. Baby crib mattresses are quite firm, and that's what babies should be on, with no pillows, no blankets, just a blanket sleeper. Breastfeeding helps, and imagine the poor family who has lost a child. So think about the emotional care we need to give to this family, and unfortunately they often are treated like this could be an abuse case, and when nothing comes up abuse, then we realize, oh no, this was SIDS. So, be very sensitive with these families. Plagiocephaly. This is an abnormally shaped head, which happens from the baby sleeping always in the same position, which is on their back. And the way to prevent this is when they're awake, give them tummy time. This is also where they're going to develop skills, those reaching and pulling and dragging themselves. So tummy time while awake and sleeping on the back. Kids tend to like their head one way, and don't let them always put their head that way. So when you put them down, put their head the other way. When it's really severe, they'll put a helmet on to kind of form the head as it's shaping and to protect it so that it doesn't keep bending just the same way or forming the same way. And here's a kid who has a pretty abnormally shaped head, probably from always liking to sleep on the same side. Apparent life-threatening event. We used to call this a near SID, so this is without treatment, this child would have died. So this is a life-threatening. They had apnea with color change, choking, gagging, coughing. This is not they swallowed wrong and coughed a little. This is they would have died with no intervention. So it requires significant intervention. So these kids, we are going to send them home on a monitor and make sure that the parents are trained in CPR. And apnea is one of the things that causes apparent life-threatening events. So the treatments for apnea are something that stimulates respiration, such as caffeine. The monitors do not prevent the apnea or the ALTE, but it notifies the parents quickly so they can come in and respond. And think of how scary this is for families. So think of family support and make sure they are trained in CPR. And here's a picture of the monitor. Some of them have a belt around the chest, some have leads like you're used to at the hospital.